Hi, everybody. Welcome to our first Facebook Live for Cura Corvette. Today I'm going to be talking about the Ito and the Pantheon units and how you can use them, as well as some treatment tips and techniques. So here we have the Pantheon research on the left and the Ito on the right. If you're a MAV grad, then you're undoubtedly familiar with these. And we've gone through this before, but let's review because many of you had not gotten an electroacupuncture unit when you first started. Okay, so here, for example, let's see if we can maybe zoom out and feel free to add some comments if you have any. So here is the Pantheon, and you'll see with this unit, this is an example of there being 4 milliampere connectors and 4 microampere connectors. And then here's a clip test. So what this means, if you've gotten one of these or you kind of forget how that layout was, that this means that I can only use either milliamperes or microamperes. Can't use both. And we teach electroacupuncture based on milliamperes. And so there's 1, 2, 3, 4. That would go with 4 different connectors and just a typical clip like that. And you can have up to 4 leads. And so when we're getting ready to attach them to the patient, we would use channel 1, 2, 3, and 4 if we have those 4 leads in. In contrast, the Ito ES130 has 3 different leads. And see if we can turn the brightness down a little bit for that. And they have not those standard round connectors, but they have a different type of attachment here, very unique to Ito. And so it only fits in one way. And this is for channel 1, 2, or 3. And so if I wanted to use channel 1, then I'm just going to insert it like that. And what you'll also maybe notice if we're just doing a compare and contrast is that it seems as though, at least with the recent wires that you get, these are some more of the older ones, that with the Pantheon, they tend to be more robust wires, although that's not really in this case the version that I have. In the Ito, usually they're a little bit thinner, but I'd say with what I have right now, they're about comparable. But just take note that it is one of the vulnerabilities of electroacupuncture that they're prone to breaking. Those wires inside the rubber area here are prone to breaking. And so you won't really know that unless you're trying it out on yourself or unless you have the Pantheon research device where you can do a clip test, which is using this little deal here. It says clip test upside down. So we'll look at that as well. But with the Ito, there's no way to test the integrity of the wires. Those of you who have been to my classes, you know I've liked both of them a lot. I find that the Ito has a bit more longevity in terms of being sturdier in general, people find. But the value of the Pantheon research is you can do dense disperse and you have more typical connectors as well. So that's one of the first things that are different. With the Pantheon 2, as I just mentioned, we have the opportunity to do continuous, discontinuous, or mixed. Mixed is that dense disperse. So continuous would be if we set, for example, on this left dial here, this is continuous frequency, and then this is mixed frequency. So this is going to be the I suppose the disperse. It just matters which you have more of, or dense if it's a higher frequency and dispersed if it's lower. But essentially, you're alternating between a lower and a higher frequency. So here we have it set at 4 and 100. So if I put it at 4 and then I turn on the first lead here, then that's going to hopefully, well, the battery worked yesterday, but it's not working now, so that's fine. If we put it on 4, then that light should go on at 4 times per second. If we then put it on discontinuous, okay, it didn't like that because I had it already on. So that this one also has a safety device where if you turn it on, so apparently the battery does work, then that tells you one of your leads is on. So you have to shut that off and go back down. So yeah, I don't know why it didn't go on. Let's just keep on playing with it. So let's put it on mixed frequency where it's going to be at 4 and 100. Oh, now it's decided to work again. Yeah, sometimes these little things, they have a bit of a quirk. Again, Ito's probably my favorite. So in this case, what you're noticing is that the light that looks like it's on all the time, that's when it's on 100 because we can't see the 100 hertz. When it's on 4, then you see this flashing supposedly at 4 times per second. So remember that hertz is cycles per second. It's not amplitude. These are amplitudes in terms of milliamperes. These are frequencies in terms of cycles per second or impulses per second. So we're going from 4 for 3 seconds to 100 for 3 seconds. And every time the orange light switches, it's showing, okay, I'm on this one, then I'm on this one. Now, a treatment tip is that if you're using a device like this, that I would prefer to turn up the amplitude when the unit is on the high frequency. So we're going to set the frequencies first and then adjust the amplitude. The amplitude is like when you're doing laser therapy, it's how bright the light is. So this is how strong the electric current is. But this is just showing your timing. That said, when you're at 4 hertz, so 4 cycles per second alternating with 100 cycles per second, there are 25 more impulses coming per second at this level. So I would rather, let's say I'm just using the 4th lead because it's easier to show you. So if I had a wire coming out of here, I would probably just first put it on. So I'm past that little click. And then when the device is on the high frequency, that's when I would start to turn it up very, very slowly, like you see here, very, very slowly. And then wait, and then I'd go up again because I figure that the patient's tolerance is more maxed out at the higher frequency, even though I am just at the time messing with the amplitude. So that's essentially how you get the dense disperse going. And traditionally, we're going to use the lower frequency on the left and the higher frequency on the right. If I then turn this back down to continuous, that's where it's going to stay at 4. And you see that it's just a beeping rather than a buzzing. And with my human patients, that's what we go on is terms we talk about, okay, you'll feel a beep versus a buzz. So the buzz is when it's high. It feels like a vibration more so. And so there's value to having the dense disperse. Let's put it back on that. The main thing being that it kind of mixes up the nervous system. So if it's just on the low frequency continuously, then the nervous system kind of accommodates to that impulse and starts to ignore it a bit faster. And when we introduce a second frequency, then it keeps the nervous system kind of attuned to what's going on. The other thing is that there are different neurophysiologic results when you're using low versus high frequency. And those haven't been completely worked out yet. I have added a couple of papers to the CuraCore website, and we will load that link into the show notes for this Facebook Live presentation. And it just discusses where some of the research is, but that's even like within the past year or two. And so we still need a lot more information about what is happening with the low versus high frequencies. And as I've taught for so long, that when we have it on the low frequency, that is more of a generalized analgesia, and that seems to have borne out over the years. When it is on the high frequency, that is more localized. So if we're going to treat an animal that is generally painful, then we can use either, and you can use both, and that's the value of the dense disperse. But let's say we had some back pain in general, maybe extending to the neck, and we wanted to go from like bladder 10 to about bladder 13. Let's say it was just in the shoulders and in the neck. Then, either one is useful here. The dense disperse is obviously great, but one of the restrictions that seems to have panned out over time is that if you're using the higher frequency, that it doesn't generalize as much. It's not as possibly endorphinergic. Those were the early thoughts before a lot of these neurotransmitters were discovered, but I think it's much more complex than that. But it seems that, like with TENS, so transcutaneous electrical nerve stimulation, that if you put TENS pads on a painful joint, that you really have to do it at the joint because it's not going to be generalized analgesia. Versus if you do have it in on a low frequency, then you're more analgized all over, depending on the intensity and the duration of your stimulus. So I think it's worth playing around with your frequencies and not getting stuck on one, especially if you don't have a Pantheon. And try it on yourself, or just for us, we do this in the labs on site, and some people definitely prefer the higher frequency. So it's not bad to use it. And again, it's not that that's intensity. You calibrate the intensity based on where you are on these dials here. So you can still start it out at so I'll go continuous and put it on, show you what even 30 looks like. So there we go. So continuous. So I put it back to 100 so the light would just stay on. But you could start out with that, and these are all off, and then I have my lead in 1, and then you can just turn it on. It's what I usually do, and then little by little, very little increments, very little, turn it up. And then with an animal, non-human animal, then we have to think about, okay, are they showing any sign of feeling it? Did the respiration change? It's a lot easier when you're working with a human that can say, okay, I'm just starting to feel it. And then I'll say, well, let me know when it's strong but not painful. And for those of you that don't know, I'm Dr. Narda Robinson. I'm a osteopathic physician and a veterinarian. So I have practices in both human and veterinary medicine, and also run CuraCore Vet, where we have our medical acupuncture for veterinarians program. So let's go now back to the Ito, and we'll shut off the Pantheon for now because we don't want the battery to run out. So I have a lot of affection for this unit, mainly because when I took acupuncture from Medical Acupuncture for Physicians course back in the 80s, this is what we learned on. It was an earlier version of it. So Just set this down so we can zoom in a little bit. And look. There we go. All right. So you might not be able to see my pointer, so I'll just go over it. So we saw before how there were 3 of these channels, and they refer to channel 1, 2, and 3. And so these are little endearing quirks on the Ito. And channel 1 is not this one. Channel 1, which is going into this wire here, is right here. So 1, 2, 3. So coming up from the bottom. And then, even though there are 4 dials here, it's this one that is a frequency setting. So as we look at that a little bit more, we're seeing too that instead of, whereas the Pantheon had dials, in this case, we have to have some interpolation. So we have a little table here, and that has at the top row low, medium, and high, and those correspond with this low, medium, and high, these little toggles. Okay, and then the frequency dial here that starts with S instead of 0, another little quirk, 0, 2, 4, 6, 8, 10. So we can turn that up. Now, if we wanted to go back to 4, like we had on the Pantheon, we see here under the L column, we have 2.5 and 5.5. So what would we do? We'd set that little dial to 7. And one of the things about these eSTIM units, they're often not completely exact, and I don't think that that matters. The nervous system isn't going to be real concerned if it's being stimulated at 4 or 8 or 20. We just don't have that amount of specificity. So if I put this at low and 7, then I'm getting somewhere between 6 and 8 and somewhere between 2.5 and 5.5. In order to see this go on, I'm going to switch on lead 1, just so it goes on just a little bit. And you see how cute this little green light is right here? And that's showing us its rendition of 4 hertz. So 4 cycles, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Kind of works out. All right. Remember, write any comments, and I will try to remember to watch them and see them and talk about them. Okay, so now if we wanted to do something like go to 100 or 80, somewhere in this region, then all we have to do is bring this over to medium, and then we see our little light here. It might be a little bit bright for you, but the little light is going on very fast. So almost looks continuous, but that's a high rate of speed right there. And so some people want to know, well, couldn't I mimic a dense disperse by just flipping? Let's say you did, okay, 1, 2, 3. Oops. 1, 2, 3. 1, 2, 3. Could I do that for half an hour? No. Number 1, that would be stupid. Number 2, that's something that would contradict what we just said when we were looking at the Pantheon, where we want to turn it up when it's at the high frequency level, instead of surprising them with 25 or 20, however many times more cycles per second that they're going to get. So what would be better is just staying attuned to your patient and changing the intensity as needed. So we're going to calibrate it here. You know, maybe they're going to start feeling it a little bit at 2 or so. It depends on your battery strength. And then if you see the needles bouncing or moving or tapping a little bit at this low frequency, so they should tap in conjunction with that rate of speed there, then okay, you're at a noticeable level, and then you could leave it there if it's not strong or just back off. And good thing to remember too is that these turn off when you turn the dial down, in case you're working outside at nightfall or something, or you can't see well. Down in front turns it down, because sometimes you're out here in Nowheresville. It's like, oops, do I turn this down or up to shut it off? Down in front. Okay, so that's the thing about the Ito. And what else do we have? There's a battery checker here that isn't really illuminated. It's a new battery, so I don't really rely on that. I just rely on the light coming on. And then there's a low, and so this is an intensity amplifier. I just leave it at low and then modify accordingly. I think that's about the main things about the Ito. When we do have people try them on site at our courses, then some people mention that they feel the Pantheon or the Ito are more comfortable wavelengths to experience. So it's kind of personal preference. And then, of course, what we've taught at our courses too, because what I learned from Dr. Joe Helms at UCLA Medical Acupuncture for Physicians course way back when, is that unless you need that middle lead for maybe some local treatment, what we do is make sure that we're not putting undue stress on these connectors. This is one area that it will break inside that plastic coating. And then I just gently wrap the wires around here. So not getting all picky about it and having them be tight, 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 because then they won't work. And then here you have a nice little portal for this one to be cozied up. But you might want to use 3. You might want to have an accentuated lead at the at a region or an area. So Pantheon isn't quite so easy to roll up like that. Unless there were any questions, I think we'll just keep on moving forward. What I'm going to do is show you the battery test. So we've got it on battery test here. That should be illuminating. Yes, it should be illuminating literally and figuratively. So it says it's a good battery, even though it was giving me trouble at first. So that is how it is. We don't use the timers because we're going to be there or somebody's going to be watching. And I would rather not rely on a machine for it to go off. But I suppose some people do. And then if we want to do the clip test back here, we're going to put this into clip test. So that's in the clip test section, right? And then we're going to take the other end of the wire and clip those leads onto there. We'll take it off of battery test and it's thinking, well, it's for that. So that's how you would do it if it wasn't, oh, let's put it on continuous. Nope. It never likes it to be on before you turn it on. Okay, let's put it on continuous now. And I would like to see, yeah, there we go. So this is a good wire because it's giving me the green there. Okay. I suppose that the Pantheon is also a way to test your patience. And if your patience isn't good, then it will notify you that you need to work on that. Okay. So if we are approaching a problem, we already mentioned back problems and disc disease. What I generally like to do is put needles before and after an area of concern. And then if electroacupuncture is deemed appropriate, then we can hook the leads up unilaterally before and after the lesion if we want. What are our goals there? Well, we probably want some muscle relaxation, and we want to modify the nervous system firing so that we are, let's see if he shows up, that we are reducing the amount of windup in that area. And so let's see where we can go here. All right, zoom out more. Okay. And maybe zoom out there. Yeah. Okay. So I always like to think about what are our goals when we're doing any kind of needling or stimulation. So let's say it's a disc problem in this region. What do we want to do? Well, if it's got some spinal cord compression, we want to reduce the inflammation. We want to modulate the circulation in that area. We want to um, keep the nerves from dying. So it's a really nice method, whichever unit you take, or if there are other units that you're interested in. I think having a nice focused level of treatment in this region pertaining to the segments that are involved is important. Now, if this was whoever it is, but they're going to be tender at that level. And that's why we span the joint. Usually they could be really hyperalgesic at that level of the disc problem. So we want to go before and after anyways. But remember that afferent input coming into the cord is going to span 2 to 3 vertebral segments or spinal segments, cranial and distal. And so, if you're coming out here, then that divergence is still going to get the involved level of the cord because it's going to come into the afferents and still affect that region. So that's a very worthwhile approach. And as we said already, that the higher frequency tends to be local. And when I originally learned about electroacupuncture back again in the 80s, that it was, we were talking more about spinal segmental analgesia, because that's about the level of the state of the research that it was. So I always think of that. But then again, this animal probably needs some overall analgesia and calming. So we could, if we have an ETO, we could spend some time on the lower frequency and then also put some on the high frequency. Or we can have two different approaches. Let's say that if it's not too sensitive, we could do a stomach 36, maybe in a LI 11 unilaterally, and then on the other side with our low frequency. And then we could do spinal segmental on the high frequency, or just mix it up. It's, it's not set in stone. I think you should really go by your gut and your knowledge and see what makes the most sense. Another thing that I think of, though, with high frequency is that it can, to some extent, fatigue the neurons or the muscles. And so if I'm working with somebody with a lot of muscle tension, then I may opt for a higher frequency because then I'm not inducing so much contraction. If I, on the other hand, am dealing with somebody that has hypotonia in the muscles, then I may just want to keep it at a lower frequency and approach more of that neuromuscular electrical stimulation kind of idea. Not that I'm going to make the muscles really contract a lot, but just going to maybe very subclinically exercise them or induce just even a faintest contraction to build the muscle tone. So there are those considerations as well. If we then turn back to our dog, if for anything with a joint problem, then again, we might have some, let's say it's hips, okay? We might have some middle and deep gluteal and superficial gluteal tension. So those of you who are accustomed to gallbladder 29, 30, and bladder 54, we could just cross the joint. Crossing the joint is a very common way to address arthrodial conditions. And we can again think, well, what are we trying to do? And some of that might be to relax some tense muscles, but let's say they have gluteal atrophy. We might then want to use the low frequency in a means to just kind of get those muscles to increase their tone. Again, not a lot of information about what each frequency does, even today. So we have to think about what does the electrical stimulation do to the tissue, and beyond just the nervous system analgesia. So, and just give it a try and see how that works. if we have generalized paresis in a whole limb, so let's say we have, we'll come back to the stifle. Let's say we have, let's say we have radial nerve injury instead of generalized paresis. Radial nerve injury, okay? And let's say they were traumatized for some reason right here proximal to the elbow. So we know that the radial nerve is created from the spinal segments C5 to T2. It actually is spanning like all these different segments. And I go here on the side of the neck because, and these are the spinal nerve points, but we often think of, oh, what about the bladder line? There's bladder 10 and there's bladder 11. There's not a point in between. Yeah, but we can needle anywhere in there as long as we're doing so safely. But the thing is that these tissues at the dorsum are supplied by the dorsal branches of the primary rami of the spinal nerves. On the other hand, the brachial plexus, from which the radial nerve arises, comes out of the ventral branches. And so we know here is the oma transversalis, and this groove in here is your spinal nerve points. So I would rather have a couple points in here for the origins of the radial nerve, and then we know that it comes out the brachial plexus and is coming around the humerus, the radial nerve groove of the humerus, and then splits into superficial and deep branches, the superficial branches supplying the dorsum of the paw, and the deep branches supplying the extensors. So again, if I have a lesion here, just like I said on the back, I would want to think about the course of the radial nerve and go before and after the break. And this is a perfect time to use your E-stem. And probably I would use a low frequency because I want to bolster it. I don't want to analgize those neurons. When there is a reduction in nerve firing, then just like if you have your hand on like one of those vibrating pads that they have for horses, or just you're jackhammering a sidewalk or something, your hand will start to fall asleep right locally there. Your leg doesn't fall asleep, but your hand will. Why would I want to numb out some of these nerves? So it's just one of those other things about thinking of the mechanisms of this stimulation and how that affects the animal. So I could hook up some E-stim there. I might also come from the neck and maybe go to LI10. And that's just another reinforcement because the glia are probably still intact. There are probably still some nerve fibers intact. But what we want to do is enhance the functional connectivity of the peripheral nerve with the central nervous system. And then for those of you that have learned from me in the last decade, we do the medical acupuncture and integrative neuromodulation protocol, which is the central, peripheral, and autonomic nervous system points. So we're drawing from those as well as myofascial. So if we have that with Baxter here, these are your central nervous system points. These are your peripheral nervous system points. We could add LI11 or LI4 for the autonomic points. And then we want to assess the myofascia. Is there, from this trauma or whatever happened, is there some continuing myofascial restriction that is causing more nerve compression or just pain or any kind of problem here? So we'll use local points for that. I mentioned that we would be getting back to the stifle. And so stifle, not always cruciate, and for sure doesn't need to be referred right away for a procedure, let's say the TPLO. No, it's not an emergency, and we have many other options. So if the animal is lame in the hind limb, then of course we're going to palpate all the way, all the dog anyways, but palpate for trigger points and taut bands. All these thigh muscles will contribute to a painful stifle. Maybe there has been a nerve compression for one reason or another. Maybe there's a problem with the popliteus that you might have forgotten about. So we palpate, we figure out where it is, and then again, we could bring in the principles that I talked about with the hip, going before and after the joint. But where is the problem? Is the problem the joint? So yes, certainly we could go with stomach 34 and stomach 36, as well as spleen 9 and spleen 10. but not all stifle pain is in the cranial aspect of the knee or stifle. So it's more important to use your cross fiber palpation and localize and find out really what's going on, what muscles are involved. Yeah, you could do a shotgun approach, but it's not going to be as rewarding. The other thing to do is think about the nervous system. And is there a compromise in terms of the nerve firing in the hamstrings, which are agonists of the cruciate? If it seems to be a laxity of some sort, can we engender neuromotor control over stifle stability by enhancing sciatic nerve function and the firing of the biceps femoris, the semimembranosus, and the semitendinosus? So thinking of all that, where else could the nerve be impinged? All kinds of things that go into your creating that E-stim protocol so that you can more appropriately remedy the situation. All right. Trying to think of anything else that we need to know. Any questions or comments? You can also email me at narda@curacore.org. Barring that, well, I think that's the summary. So remember that E-stim can be well tolerated. It just matters how you're going to approach it. The other thing is that if you are just using silicone-coated needles, that, especially with animals, they can tend to fall out. They're very slippery. So you might want to consider a non-coated needle. And there are there's a lot of those. There's Huatos and there's Carbos. A lot of people really like the Carbo needles. And that will save you from having to reinsert the needles when they fall out. Another thing in terms of a treatment tip is that you want to make sure that I see a comment. We will ask that. We will address that. Thank you, Nancy. That when you are hooking up the leads, that make sure that the wires are not going to have such memory that they're going to pull out your wire. So these green and whites, they're pretty old leads, but you can see with this wire, there's a bit more chaos. But even these have been in use for a while. When you first get them out of the box, they're going to remember, oh yeah, I was wound up. So that could also pull out your needle, which becomes an electrode. Nancy asked, do you use the acupuncture and TENS switch on the Pantheon? Here it is. Let's see how you can read it. And anyway, it says here TENS versus acupuncture. Obviously, you want it at acupuncture and not on TENS. Why would that be? Well, TENS involves the transcutaneous electrical nerve stimulation. And that means that these are pads that are going on the skin, and the electrical stimulus needs to be strong enough to get past the resistance of the skin, which is pretty formidable. With acupuncture, that's percutaneous electrical nerve stimulation. So we're bypassing that skin resistance because we have the needle. So the output on the Pantheon is going to be lower for the acupuncture level. So make sure it's there so you're not shocking anybody or surprising anybody, let's say. Okay, well, thank you for attending. I encourage you to check back for the notes to see those 2 papers that are available for free download and learn a little bit more about E-stim. So thanks for being here, and see you at the next Facebook Live.